Good afternoon, everyone. Welcome to this afternoon's Peoria Health Department daily briefing. It was 1 week ago today that Governor Pritzker issued the COVID-19 executive order directing all of us to stay home, only to go out for essential services. In the last 2 weeks, we've seen several restaurants modify their business models to provide curbside and takeout. The Peoria Area Convention and Visitors Bureau has a list of restaurants where you can get food delivery and pickup if you go to enjoypeoria.com. We've also seen some businesses temporarily close their doors while we all continue to follow the stay-at-home order. Whether it's an entrepreneur taking a risk on their first startup or a long-standing family business, these are important assets to our community. We encourage the public to support these businesses when they can. Order takeout, buy from them online, purchase gift cards, etc. Small businesses are the backbone of our economy, and many of these people who work there know us by name as customers. Your purchases will help sustain their livelihood during and after this uncertain time. To put this into perspective a little bit, there's 30.2 million small businesses in the United States, and that comprises about 99% of all businesses in our country. They employ 58.9 million people, and it's over 47.5% of our country's total workforce. So that just puts real numbers into the importance of our small businesses. If you're a small or any business owner, please know that there are resources available for you out there. We're trying to get good information and good resources out. The economic development staff at the City of Peoria has resources for our city businesses at their page, growpeoria.com, under the COVID-19 tab. You'll find information on programs there that are specific to Peoria. Chris Setti is the CEO of the Greater Peoria Economic Development Council and also the interim CEO of the Greater Peoria Chamber and the CEO Council, and he's going to be speaking to us in a couple minutes today. We just want everyone to know that we're doing everything we can to help our small business community, and we please ask that you do everything you can to support them during this time. As Chairman Rand from Peoria County and Chairman Zimmerman from Tazewell and Chairman Krug from Woodford and I continue to talk to you on these daily meetings, we want to reinforce the importance of the stay-in-place initiatives. We're just finishing a week today. We know some people are getting a little anxious about being stuck at home, but it is so important for our community and that we can come out of this quickly on the other time. So with the weekend coming up, just hunker down and try to persevere through this for us. Before I go, I'd probably, like a lot of the rest of you, getting these daily memes and other things electronically to try to lighten things up a little bit or make us contemplate the situation we're in. I got one this morning from a friend that I'll just share before I turn it over to Monica, and it says, "In the rush to return to normal, use this time to consider which parts of normal are worth rushing back to." Monica?
Thank you, Mayor Artis. For today's briefing, again, wanting to focus on the confirmed positives within the Tri-County region. We have 6 confirmed positives in Peoria County, 3 in Tazewell County, and 3 in Woodford County. The additional new case in Tazewell County brings that complete total up to 12 for our Tri-County region. We do know locally there are some positive cases that are currently hospitalized within our healthcare systems. They are not residents of our county, and I just want to again focus on why we are going to be utilizing this platform to talk about confirmed cases of our Tri-County residents. We recognize our healthcare systems are impressive here locally, and their reach is very broad, and some of our more rural communities do send patients here for their higher level of care. So with that, while we are aware of them, we don't share those numbers because those are considered residents of other counties. So with that, again, there are 6 in Peoria, 3 in Tazewell, and 3 in Woodford. Currently in the Peoria and Woodford, all are at home recovering. Tazewell currently has 2 that are hospitalized and 1 that is at home and recovering. Additionally, tomorrow, McLean County Fairgrounds will be hosting a community-based testing. This is actually a federal government sponsored event. These are federal assets through FEMA, or the Federal Emergency Management Agency, as well as HHS. It is coordinated locally, but again, the assets are coming from the federal level. They're focusing on healthcare providers, first responders, seniors over 65, and patients with underlying health conditions, all that have symptoms as well as a fever. So again, asymptomatic individuals or individuals that don't meet this criteria would not be considered for that testing at those facilities at the time. The mayor said it best that this is now going on our first full week of our sheltering in place, and we've had a lot of community reach out to us and just share the things that they've been doing in terms of bringing this and really understand that this intervention is a medical intervention. It's not necessarily prescribed from a doctor, but the way to think of it is that we are as a full community prescribing to this policy. And many of our businesses are impacted. To fully understand that, I'd like to introduce Chris Setti, the CEO of the Greater Peoria Economic Development Council.
Well, good afternoon. I'd certainly like to echo what both Monica and the mayor said about the importance of small businesses in our community, and we know how businesses of all shapes and sizes have been impacted by what is a public health crisis that's turning into also an economic crisis. And I'd like to recognize, we talk a lot about small businesses, but there's a lot of independent contractors, entrepreneurs, they're all impacted by this. So at the Greater Peoria Economic Development Council, we've been asked to be that source of information for the business community. So it does feel like longer than 2 weeks, but I think it's just only been 2 weeks trying to collect and distribute information regarding what resources are important to business. A lot of that started with what sorts of things they could do to keep themselves safe and their employees safe. It is now turning much more towards what programs are available for businesses. So on Wednesday or Thursday, the governor announced 3 new programs to help small businesses that are at the state level. Just about an hour or 2 hours ago, the U.S. House of Representatives passed the relief bill that has a lot of programs that are available for small businesses. And also for those independent contractors. A lot of those programs are also for those folks that we wouldn't ordinarily lump into the small business category. And also for some larger businesses as well. So my message to the business community is that help is on the way. It'll take us a little bit to sift through these programs, to learn about their rules, their applications, their time frames. But there is help out there, and whether you're in Peoria or in Peoria County or across the river in some of our other counties and cities, there are people there that are gearing up to help. We have been posting all of our information daily at www.gpcovid.com. That's gpcovid.com. We have every resource that we can find that is applicable to business up there. And so I would, again, echo the mayor's comments that what we really need to be doing now is pitching in and helping our local businesses by shopping locally if we can, shopping online if we can, going out to eat, or I should say, going and grabbing, carry out from these places, because you're going to want them to be there when all of this ends. So thank you very much. I'll turn it back over to Monica for questions and answers.
Thank you, Chris. With that, opening up for questions.
Monica, as you mentioned, the drive-through testing site in McLean County, Dr. Stoner had mentioned a couple days ago that we might be seeing a testing site similar to that in the Peoria area. Any timeline on when that could occur?
So right now, the question being, is there a timeline to have a similar testing site available here locally in Peoria? From a state asset and even a local asset, we don't have that capacity yet. So assets that are being utilized for this type of testing in McLean are from our federal counterparts and being staffed, though locally, a lot of the setup is from our National Guards and other federal entities. Every time the days go on, we get better and better testing possibilities. And one of the ones that we are looking for is when we can maybe transition to having point of testing here locally. That would be a huge transition. At the same time, though, the materials to do testing is what is that limiting agent. We don't have enough reagent. We may not have enough swabs for testing, things of that nature. And right now there is a prioritization in those high-risk areas where we're seeing a lot of cases that are increasing by a magnitude of 2 almost every day. And so we are on a wait list. We know we are on a wait list. Part of us just continues to monitor that, and our healthcare system continues to monitor that as well, ensuring that we're still prioritizing our testing that with the supplies we have, but with hopes of that eventually we get that, again, increased testing capacity here locally.
You know, if the McLean County testing site is open to residents of our area as well, or is it strictly people who live in McLean County?
It's actually open to the region as a whole. So there have already been 3 such types of community-based testing in the Chicago area. This one is to service the central Illinois area, and then there is going to be another one, I believe, for the southern part of our state.
So anybody from anywhere across this area that fits one of those criteria you mentioned earlier can come to the site for testing, potentially?
So for that testing specifically, those that meet that criteria would be eligible, and they would need to have the symptoms as well as the fever, but again, be healthcare providers, first responders, individuals over the age of 65, and those individuals with a pre-existing medical condition. There is a screen point. They are asking people to have documentation to help go through that process.
Monica, when it comes to testing, is this something that the people are going to have to start paying for? I mean, how much does a test cost?
So my understanding is the testing that is being done through the conjunction with FEMA and HHS is actually a free testing. Again, wanting to know what the levels are we have in our community. In terms of testing moving forward, as any type of medical thing, I believe the federal government has talked about it too, it really is trying to be at a very low or no cost for the public, understanding that this is a measure to help control our pandemic.
Is it walk-in?
It's-
People can still walk in with the documentation?
It's drive-in. So
Drive-in, okay,
exactly,
yeah.
it's a drive-in clinic. So people are going to be confined into their cars to limit, again, exposure and create both a physical barrier and a spacing barrier when they do the drive-in clinic.
But people can decide tomorrow morning, we're going to go to this and go. They don't have to make an appointment.
No, I do not believe they need to make an appointment, but there is limited amount of testing, and so they are going to make sure that they are able to do as many as they can. Again, for that 4 groups that were designated.
And today, both OSF and Union Point sent out separate releases talking about ways the community can help, and there was all sorts of stuff in there, everything from ways we can maybe use face masks people have made in non-critical care situations to, we need people with these types of skills or knowledge. I mean, can you talk a little bit about do you know what spurred that call to action today?
I think the spur to action in terms of the planning from our healthcare providers is just the fact that our healthcare providers understand the importance of what the next few weeks mean. If we don't see a true flattening of the curve, if for some reason restrictions change in the next few days, they really need to be gearing up and planning for that. And I think it just shows the strong leadership we have in the healthcare system, that they recognize the issue and want to work earlier versus at the 11th hour on this.
And the Unity Point release mentioned ED tents at Methodist and Pekin Hospital. Can you talk a little bit about that?
Yeah, so in terms of tents, there are tents available or set up now outside the EDs as well as OSF. And these tents are actually part of a triaging system for respiratory health. They're not up online yet or operational. They're just gearing up. And in fact, I will also use this time to also note that we are possibly headed for some severe weather tomorrow. And so with that, there's a lot of discussion across the state about making sure anyone that has utilized these tents for triage are doing the proper mechanisms to secure them for safety reasons. But they are, again, gearing up, making sure they're prepared for the weeks to come.
So with the tents, are they geared towards somebody who comes to the hospital showing, these symptoms of COVID-19 to isolate them, or who's it geared towards specifically?
These tents specifically that are coming up in the hospital systems are being geared up for those that are for respiratory triage. So they're showing a COVID-like illness, or CLI, and making sure that they're able to triage them properly before bringing them in. So again, creating those staggered steps towards triaging, which was a recommendation that was pushed out from the Illinois Department of Public Health and CMS just last week.
And then OSF mentioned they were looking for specifically, I forget the exact term, but it was basically workers who can go to somebody's house to treat them. And I know you had mentioned that in the past, that some people had had OSF employees go to people's houses to treat them or screen them for COVID symptoms. I mean, is that the strategy moving forward here, rather than having people come in?
I think when we can limit the number of people coming into a healthcare system, that's a better way to manage this issue. Again, we don't want to put burden or create increased transmission or exposure in our hospital systems. And so by doing things such as outreach or doing, well as telehealth versus home visiting, all of those are great strategies to address this. There's no one single silver bullet situation in this, and I think our healthcare systems are looking at any type of mechanism possible, again, to just slow down that transmission.
Monica, we talk a lot about the mental health, we were talking about it of children and then of the elderly. What steps are being done to help the mental health of patients that are currently in the hospital that, aren't allowed to have visitors now?
So I can't go into the specific details, but our hospital systems have recognized how behavioral and mental health are really key parts of comprehensive health. And so both healthcare systems have integrated healthcare, whether it's on-site services or referral systems. And so they have been working with individuals to help them understand, have coping strategies, as well as work to make sure that there are ways for them to connect with family members that aren't able to be present. So whether it's using electronics to FaceTime or Google Chat, what be it, but to make sure that connection, because having a strong mental health, it will help in a recovery as well.
Monica, seeing the increase in positive cases, I know we are slowly increasing, but is that really a number to be afraid of, or more of a comfort that more testing is available right now?
That's a great question, whether or not how we should kind of interpret these numbers. Is it understanding that this is inevitable, that we are kind of following the track of everything else, or is it, the fact that we have more testing? I think the tests that are coming in, the positive confirmed test, are expected by our community. We know that no place is immune to this and no individual is immune to this. So monitoring that is something that we've been doing, and it kind of lends a sense of where we're at. I don't necessarily say it gives us comfort in terms of expanded testing, because we're still prioritizing, but I think the numbers indicate the fact that as a community, we should understand that it is in our community and what we can do to, again, decrease that transmission.
Question for Chris Setti.
Okay.
Go ahead, Tim.
Hey, Chris. So the Department of Labor came out yesterday with the unemployment filings nationwide. And I know in Illinois it went from about 10,000 the week of the 14th to about 114,000 the week of the 21st. I was just curious if you had a sense of the Peoria level data on that.
No, none of that data has been made available yet, and we don't usually get. That's actually pretty fast even to get statewide data. I think it's just because it was such a surge. We probably won't see that data for another few weeks. But I mean, anecdotally, we know that we probably have at least a proportionate share. I do think we're somewhat lucky in the Peoria area because so much of our workforce is tied up in both healthcare, which is obviously an essential service, and also manufacturing. So some of our larger employers still have a lot of their employees to work, but we do know that there are a lot of people out of work from the service industry, from the retail industry. So it won't be surprising to see that number spike pretty high, just like it will everywhere else.
And then the new parking spots downtown for curbside pickup, I mean, how's that working out so far? It's been a few days now, right?
You know what? I don't know. I haven't been downtown because I've been working from home. So I appreciate that the city of Peoria had the forethought to do that. To bag those meters and create one less barrier for folks to pick up from places like Kenny's West Side and Rumburgers and places like that. But this is the first time I've actually been out of my house at a business meeting or a business function in a week and a half. So I have not been downtown myself.
After this outbreak is under control, would you say that Peoria will be seriously hurting?
I think the country is going to be seriously hurting, and I would be naive to say that Peoria and the Peoria area won't be have its problems too. But I don't say that in some sort of fatalistic way. I said this on a radio interview the other day. We're the economy that our entire economy was made illegal overnight by prohibition, and we're still here to tell that story, and are still here. So we're an incredibly resilient community. And we have a resilient economy, and we will get through this. But there are going to be some difficult times. There's going to be some businesses that don't survive this, most likely. But there's going to be new businesses that start as well. So I'm looking, forward to the challenge of helping to get people back to work and getting the region moving again.
I guess to put it, straightforward, when we look at the number, when people hear the number 12, I guess if you could discuss how, in a way that kind of sugarcoats the true situation, we have people that are going in groups to Walmart just to hang out, like we've had employees call us telling us that. I guess if you could, emphasize, how big of a deal this is to the general public. We had the governor yesterday saying that even having a dinner party is spitting in the faces of healthcare workers. If you could just emphasize, how important this really is.
So in terms of the number 12 and how accurately depicts for our community what the level is. So 12 represents the amount of positive tests we have in our community. And to understand this virus, the best way to understand it is that there is a number that talks about how many people get the virus if one person is infected. So, for example, for influenza, for every one person that is sick, 0.1 is somebody that gets sick from influenza. So it really is less than a person. It's a tenth of a person. But for this coronavirus, it is anywhere from 2 to 3. Average is 2.5. So, again, those are people that we know of that have been tested. So that means they had to be symptomatic and to a level that they were admitted to the hospital or went to a hospital visit. Again, that's a very small percentage. 80% of people will have mild symptoms and not necessarily seek medical care or need to seek medical care. So that number of 12, when you think about the fact that those are positive tests, so they had to be people that were tested. So we don't test everyone. On top of that, they have to be at a condition that required them to need to be tested because their symptoms were so advanced. And again, 80% of people are going to be mild. This is a very small percentage of actually what we are seeing in our community. And I think that's where people need, again, remember that it is in our community and really be more focused in terms of not the numbers that are tested or confirmed, but under the expectation that anyone has it and we should actually act as if we have it ourselves and that we don't want to share it with others.
Monica, there was some information, I believe it was last week, about how to not take ibuprofen when you have COVID-19. Do you know if there's any updates to that and why Tylenol is the better alternative?
So the question is whether or not to utilize ibuprofen in terms of COVID-19 response. And there is a lot of information. I think that's something that's been really interesting about this pandemic is the fact that multiple countries and different researchers across the globe are looking at this virus in different forms and fashion. And with any type of virus, they want to understand why some people get sick, some people end up being healthier, kind of what are those differences. And ibuprofen was a medication that did come up in these studies. What's really difficult is that there's not enough information out there. It's a very small body of literature around this, and with any type of scientific information, and you want to make scientific decisions, you want to do your due diligence. And so I think the jury's still out for that. best thing you can do is talk to your healthcare provider. They will know what your current health is, they will assess it, and then determine what best course of action is for you.
If restrictions were retracted by Easter, which is next month, would you say that matters would get worse? And by restrictions, social gatherings, or gatherings and social distancing?
And so I think the question is, if the restrictions were lifted by Easter, will we see this get worse or better? The social distancing, it's still too early, the sheltering in place, to determine whether or not we are being successful. Right now, our measurements are things such as cases or tests, which again is a very small population, or even hospitalization. Again, that's still a small population of those that are going to be fully impacted by this. And so to fully understand this, it takes about 2 weeks for this intervention to work. And so I think it's too early to tell whether or not what we have been doing and how well we've been complying has been made enough of an impact for that we can say by Easter that if we go back to gearing back up to normal, would we be on the safe side? So I think it's still, again, jury's out for that one as well.
You talked about drugs that, ibuprofen might make it worse. I've heard that steroids can make it worse. A little girl who was diagnosed with RSV, the doctor didn't give her steroids, which would be a normal treatment, just in case she had COVID-19. What about, if you have allergies and you use a nasal spray that is, I think it's a steroid, is that something you should stop using just to make you more immune to this when you come across it?
I think the question in terms of what medications, whether they're steroids, ibuprofen, any type of things that have kind of come through the news cycles about, what should people use or what shouldn't, it really is a decision between you and your healthcare provider. They're going to know your existing conditions, they're going to understand your health history, and based on that information, they'll be the best to provide you guidance on how to properly treat and recover from this virus. Well, thank you, everyone. With that, we will not have any briefings over the weekend unless something changes. Otherwise, we will see you guys on Monday at 3:30. Thank you.